Before the surgical procedure, all the basic parts and components must be inspected for functionality. This is done by ensuring the surfaces facing the patient are smooth, as well as the free movement of all hand wheels. Assemble the front support parts into one unit. Now insert the single-use pads and secure their position. This hip fix model is equipped with single-use soft foam pads. It secures the patient laterally at a 90-degree angle relative to the operation table's surface. Do the same check for the back support. Insert the single-use pad and secure its position. For optimal hygiene, only use the pads once. The rail clamps should be checked for wear and correct fit to the side rail. There are rail clamps available for all side rail dimensions. Mount a rail clamp on each side of the operation table aligned with the greater trochanter of the patient. With the patient supported by an assistant on the back side in the lateral position and slightly angled backwards, begin by mounting the front assembly onto the rail clamp. Release the lower hand wheel. Palpate the lower iliac crest and slightly depress the mattress with one hand and push the pad against the area before tightening the hand wheel. Make sure to check that the pad is fully inserted in the holder and that no parts of the skin are jammed between the support and the mattress. Next, palpate the upper iliac crest and release the upper hand wheel in order to adjust for the correct position of the upper support pad. For support at the rear of the patient, insert the post into the rail clamp and adjust corresponding to the patient's sacrum. Now insert the back support into the brass coupling from the outside and use your body weight to push the support against the patient before tightening the hand wheel. A final check of the pad position and the stability of the patient completes the positioning procedure. To complete the procedure, make sure that you support the patient while first removing the complete rear assembly and rail clamp. Removing the front assembly should be done with the patient supported. Lift the assembly and remove the rail clamp. Visually inspect the patient's skin relative to the pad applications and report any pressure marks that are not acceptable. Opitek International. Medical devices for the operating theater.